Have you had rapid weight loss leaving your face looking older, hollow, or saggy? Well, you're not alone. This is what people are calling Ozempic face. But what if I told you there's a way to reverse it without surgery? Here's the truth. Losing weight doesn't have to make you look older. In fact, injectables can make you look even better than before. But here's another important part. Restoring volume is only half the battle. What if I told you there's a way not to just add volume, but also tighten and rejuvenate the skin at the same time? I'm Dr Owen Thomas. I'm an aesthetic doctor in London, UK. Keep watching because I'll explain how combining fillers with advanced skin treatments can give you longer lasting, even better results. So let's start with the basics. What exactly is Ozempic face? It refers to the changes in facial appearance after significant weight loss. While the name comes from the medication Ozempic, the effects aren't limited to that particular drug. Similar changes can occur with weight loss following bariatric surgery, extreme dieting, or any form of rapid weight reduction. So the key is not the medication itself, it's the loss of fat from the body and the face. When we lose weight quickly, the fat pads in our face shrink, leading to hollow cheeks, sagging skin, and an overall aged appearance. And of course, that makes people feel self-conscious, even if they're thrilled with their weight loss results. But here's the good news, this is not permanent and there are solutions. So part of the reason Ozempic's become such a hot topic is not just the amount of weight loss, but the speculation surrounding celebrity weight loss. Elon Musk openly credited Wegovy, a similar medication, for his weight loss success. And Sharon Osbourne, for example, has admitted to losing over 30 pounds using the weight loss injections. She's also subsequently talked about the challenges of maintaining those results after stopping the medication. So while celebrities might make these treatments look effortless, it's important to note they require commitment. Typically, surgeries can cost hundreds of dollars each, and studies show that up to 2/3 of lost weight can return within a year if the treatment is stopped. So what are GLP1 drugs and how do they work? GLP1 receptor agonists like Ozempic and Wegovy, that's semaglutide, and Saxenda, which is liraglutide, were developed to treat type 2 diabetes. More recently, they've been used for weight loss as they mimic a hormone called GLP that regulates our blood sugar and our appetite. A newer medication known as Mounjaro, tirzepatide, works on two pathways, making it even more effective for weight loss. The drugs work by slowing digestion, boosting insulin, and reducing hunger signals in the brain, and as a result, patients feel fuller and can achieve significant weight loss. So with Ozempic and Wegovy, average weight loss is about 10 to 15% of total weight over 6 to 12 months. With Mounjaro, there's even more impressive results, some patients losing up to about 23% of their total body weight. And with that amount of weight loss, it's unsurprising that the face might become a bit more gaunt. There's also a reduced intake of protein and vitamins, and that can accelerate collagen loss in the skin. I'm going to give you a few tips in a second about what you can do to prevent that. So while these results can be life-changing, they often come with unexpected side effects, particularly in the face. So in the cheeks, we've got fat loss that occurs in the buccal and malar regions. That flattens the cheeks, deepens the nasolabial folds, and contributes to sagging. In the temples, sunken temples age the face. They can cause the brow to droop, making the upper face look hollow and peanut-shaped. In the jawline and the chin, reduced fat leads to jowls, skin laxity, and a less defined jawline or recessed chin. And in the eyes, volume loss around the delicate tear trough area can create dark circles, a hollow appearance, and thinner skin that exposes blood vessels. Finally, in the forehead, flattening can reduce the contours, that nice smooth structure, the elasticity, and that can also amplify brow descent and a tired expression. So maintaining healthy skin definition and minimizing collagen loss while on weight loss medications requires a holistic approach, and this includes diet, regular exercise, and the strategic use of supplements. Eating a diet rich in lean protein, healthy fats, and a variety of fruit and vegetables provides good nutrients that the skin needs to stay resilient during weight loss. Protein in particular is crucial, as that supplies the building blocks for collagen production, and that supports skin structure and elasticity. Incorporating foods high in antioxidants like berries, leafy greens combats oxidative stress, which also contributes to skin aging. Exercise should not be forgotten. That plays a pivotal role, improves circulation and promotes better oxygen and nutrient delivery to the skin, and that helps maintain its vitality. And collagen supplements, I think, can be a game changer. These supplements contain hydrolyzed collagen peptides that are easily absorbed by the body, supporting the skin's structural integrity from within. And many of these also boost very high protein levels, which further enhances overall skin and body health. If you're curious about collagen supplements, I've covered them in detail detail in another video, and you can check that one out here. So what can we do medically to reverse these changes? This is where injectables come in. I'm going to explain the two types I use, and later on I'm going to explain where I place them for maximum effect. So the treatments are dermal fillers for structural support and biostimulators for skin and superficial improvement. Think of your face as a house. The dermal fillers are like rebuilding the foundation and the support beams deep inside, restoring that structure that keeps everything stable and in place. Once the foundation is strong, the biostimulators act like a fresh coat of paint and new plaster on the walls. They smooth out imperfections, strengthen the surface, and give the whole house a rejuvenated, polished appearance. Dermal fillers are injectable treatments. They're designed to restore lost volume, redefine contours, and rejuvenate the face. They can replace fat that's been lost during weight loss, lift sagging areas, and smooth out lines and folds. Hyaluronic acid fillers are the most popular choice for adding structure and hydration. They're particularly effective in deeper areas like the cheeks and jawline where more support is needed. You might have heard of products like Juvederm Voluma and Restylane Lift, which are commonly used, and these provide instant volume that can last usually between about 18 and 24 months. They're reversible, importantly, making them a very safe and flexible option, especially to those who are new to aesthetic treatments. Biostimulators, on the other hand, like Sculptra and Radiesse, work differently. Rather than simply adding volume, they stimulate the body's natural collagen production over time, and this leads to gradual, natural-looking improvements in skin texture and firmness. Results with the biostimulators develop over about 4 to 6 months, and they can last more than 24 months, and that's ideal for areas where collagen loss is a concern, like the temples and the lower face. Wait till I tell you afterwards how effective they are. So with my treatment, I begin by addressing the areas most impacted by significant weight loss. That includes the cheeks, temple, jawline, and chin. I'm using dermal fillers underneath the muscle, deep down into the inner cheek, and you can rebuild and support and get a nice convex contour. The temples are quite a complicated area with many layers, so I can treat the deep down fat and the superficial compartment with different techniques, and that restores volume and it softens the transition between the forehead and the cheekbones. In this area, I always use ultrasound guidance to enhance safety because you just don't know where the blood vessels might be. In the jawline, you can do strategic placement of filler, including the sulcus, which is the gap between the chin and the jowl, further back in the mandibular angle to restore a nice, sharp, youthful contour. In the chin, you've got projection and balance, and that's key to re-establishing harmony in the face. For most of the treatments, I prefer using a cannula rather than a needle. Cannulas are little tubes, and they reduce the risk of trauma to blood vessels, they minimize bruising, and they allow for much more controlled and precise filler placement. Once the deep structure has been restored, then I move on to do the superficial fat compartments in the skin, and this is where the biostimulators really shine. They do more than just replace volume, they actively stimulate collagen production, and that improves skin thickness and texture, and is a great finishing touch because the fibroblast cells, which produce collagen, reside just underneath the skin, and these can be stimulated well up until your late 70s and early 80s. So for the biostimulators, you can use either Radiesse or Sculptra. You can check out my video about Sculptra here. I particularly like using this in the face as it doesn't tend to cause any swelling, whereas Radiesse, which is pretty on par, can leave the face a bit puffy for a day or two. And you can use biostimulators widely in all of the areas affected by Ozempic Face. That includes the area around the eyes. It's a delicate area, and using biostimulators can smooth the fine crepey lines and rejuvenate the under eye area. In the mid-face and labial folds, it gives a nice smoothing effect over the top, improving skin elasticity. And in the lower face and jawline, that can tighten and smooth the skin, helping jowl support and complement the structural support from the fillers. So the results from biostimulators are pretty striking. In one study at month 3, Sculptra patients saw a 66% improvement in type 1 collagen. 100% of patients still showed objective improvement of wrinkles 2 years after the treatment, and almost 100% of patients, 94%, agreed that the results looked really significantly improved at 2 years. So the layered approach, which is rebuilding the deep structure with dermal fillers in the deep fat compartments and refining the surface with biostimulators, achieves a really natural, rejuvenated appearance. It restores the youthful plumpness and the contours that might have been lost or worse with Ozempic Face or weight loss. All of this can be done safely and comfortably. So with this treatment, the goal is not just to reverse the signs of weight loss, but leave people looking radiant, refreshed, and much more themselves. My favorite biostimulator in the face is Sculptra, although in the body it's Radiesse, and they're pretty close together. Biostimulators are really increasing in popularity. If you want to find out more about them, you can check out a video I made on one here, and I will see you in the next one.